Good evening, doctors. A very good evening to all of you. Today, we are going to solve some MCQs of pharmacology. Pharmacology is a very important subject and it is very good scoring subject. About 25 questions are expected to come from pharmacology, and this will help you boost your score a lot. Some of the questions of medicine also have pharmacology, so it is a related subject. PSM can also ask questions on pharmacology. So if you prepare pharmacology well, you are expected to solve more than 30 to 40 questions of pharmacology easily, naturally, and automatically. So the more you practice, the more you will be able to solve the questions in the original examination very easily, automatically, and naturally. So, friends, let us begin with the first multiple choice question. Anandamide is A. Opioid, B. CK1 antagonist, C. D2 blocker, D. Cannabinoid neurotransmitter. Anandamide, also known as N-arachidonic ethanolamine or AEA, arachidonic or AEA, is an endogenous cannabinoid neurotransmitter. The name is taken from the Sanskrit word ananda, which means bliss or delight, and amide. It is synthesized from N-arachidonyl phosphatidyl ethanolamine by multiple pathways. It is degraded primarily by the fatty acid amide hydrolase, that is Fa enzyme, which converts anandamide to ethanolamine and arachidonic acid. As such, inhibitors of Fa lead to elevated anandamide levels and are being pursued for therapeutic use. So, anandamide is a cannabinoid neurotransmitter. So, the correct option here is D. Now, this question is very important. GP2B3A inhibitors. You must know the names of GP2B3A inhibitors. So GP2A inhibitors are all abciximab, eptifibatide, tirofibam, and prasugrel. So the correct option here is prasugrel. Then GP2B3A inhibitor. The platelet glycoprotein mediates platelet aggregation via binding of adhesive proteins such as fibrinogen and von Willebrand factor. GP2B3A inhibitors inhibit platelet aggregation by blocking GP2B receptors. They are more complete inhibitor than either aspirin or clopidogrel or ticlopidine because they inhibit final pathway in platelet aggregation. Final pathway in platelet aggregation. So the drugs which are GP2B inhibitors are abciximab, tirofiban, eptifibatide, lamifiban. So the correct option is prasugrel. Abciximab, eptifibatide, tirofiban, lamifibab, fiban are all GP2B3A inhibitors. Mode of excretion of cyclophosphamide is A. Lung, B. Liver, C. Kidney, and D. Skin. The correct option here is cyclophosphamide is primarily metabolized 80% and metabolites are excreted in urine. 10 to 20% is excreted unchanged in urine and 4% excreted in bile. So mode of excretion of cyclophosphamide is kidney. So the correct option here is C. Beta 2 agonist. Beta 2 agonist are all cause all. Clinical effects of vitamin D is reduced by A. Simultaneous ingestion of phytates, simultaneous ingestion of lactose, C. Acidic environment. So the correct option here is A. Simultaneous ingestion of phytate. So, vitamin clinical effect of vitamin D is reduced by simultaneous ingestion of phytates. The main clinical effect of vitamin D is enhanced intestinal absorption of calcium. With an average intake of 1000 mg of calcium, its net intestinal absorption is only 150 to 250 mg per day. Calcium is absorbed mainly in the duodenum and jejunum, that is proximal intestine, by an active transport mechanism which is regulated by 125 OH2 D-calcitriol. Parathormone indirectly promotes absorption of calcium by increasing the renal synthesis of 125 OH2D3. Dietary lactose protein and an acidic environment. Dietary lactose protein and an acidic environment promote calcium absorption. On the other hand, phytates, phosphates, oxalates, tetracyclines, and alkaline environment impair calcium absorption. So, acidic environment promotes the calcium absorption, whereas alkaline environment discourages absorption of calcium. So, the correct option here is A. Sugamdex, Sugamadex is used for A. Organophosphate poisoning, B. Reversal of neuromuscular blockers, treatment of local anesthetic poisoning, treatment of central anticholinergic syndrome. Sugamdex. Reversal of neuromuscular blockers. Sugamdex is a novel reversing agent developed for terminating the action of non-depolarizing muscle relaxant, rocuronium and vecuronium. It is a modified Y-cyclodextrin with high affinity for rocuronium and vecuronium. It encapsulated one molecule of neuromuscular blocker within its molecule for forming an inactive chelate, which is excreted in urine with VA of 2 hours. Its side effects are mild precordial pain, nausea, alteration of taste, and rarely allergy. So the correct option here is B, reversal of NM blockers. Acidic drugs bind to acidic drugs bind to. We all know it is albumin, but let us dive deep into this. Many natural substances circulate around the body, partly free in plasma, water, and partly bound to plasma protein, that, for example, cortisol, thyroxine. Similarly, drugs circulate in protein bound and free states, and the significance is that the free fraction is pharmacologically active, whereas the protein bound component is a reservoir of drug that is inactive because of this binding. Acidic drugs generally bind to plasma albumin. Acidic drugs generally bind to plasma albumin, whereas basic drug binds to acid glycoprotein. Binding of albumin is quantitatively more important. So the correct option here is C. Duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability, D. All. Duration of action depends on. Correct answer is D. All. Which one of the following drug can cause thyroid dysfunction? Amiodarone, ampicillin, ibutylate, cyclovir. The correct option here is A. Amiodarone. Dopamine, all of the following is true. Positive inotropic improves renal perfusion, causes vasoconstriction, except causes increase in GI ischemia. Now, let us see what about something about dopamine. Dopamine acts on dopamine, that is D1 and D2, and adrenergic alpha 1 and alpha 2 receptors with no actions on P receptor. At lowest effective dose, it stimulates D1 receptors in renal and mesenteric blood vessels, improves renal and mesenteric perfusion. It causes improved mesenteric perfusion. At moderately high dose, it is positively inotropic. At high doses, it is a vasoconstriction. So correct option is increase in GI ischemia. The side effect of digitalis are all except. Side effect of digitalis are all except. Digitalis causes mild vasoconstriction, not vasodilatation. So correct option here is B, vasodilatation. Anti-androgen used in heart failure is it is spironolactone. Anti-androgen which is used in heart failure is spironolactone. Spironolactone. Spironolactone and eplerenone are the aldosterone antagonists. They are used as a potassium-sparing diuretics. Their diuretic effect is quite feeble, but in CHF these drugs reduce the mortality at doses lower than diuretic doses by antagonizing the effect of aldosterone. Spironolactone also possesses the anti-androgenic effects. Gemcitabine is mainly used in pancreatic cancer. Sorry, it is pancreatic cancer. It is by mistake. Maximum liver toxicity is seen with anti-TB drug. It is pyrazinamide. Fastest acting antithyroid drug is iodide of Na and K. Natalizumab is used in the treatment of multiple sclerosis. Special feature of glargine insulin is it produces a smooth peakless effect. Mechanism of action of trilostane is 3-beta hydroxysteroid dehydrogenase inhibitor. Treatment of choice of cheese reaction is it is pentolamine. Essential drugs are those satisfy primary healthcare needs of population. Post-marketing surveillance is included in phase. It is phase 4. Which one of the following is most active against slowly dividing tuberculin bacillus? Rifampicin. Drug contraindicated in G6P deficiency are D. All. Chloroquine, primaquine, quinine. Which of the following are competitive inhibitors of tyrosine kinase? It is imatinib and sunitinib. Ranibizumab is a monoclonal antibody against VEGF. With this, we conclude with the MCQs in pharmacology. Tomorrow morning, we will come with more detailed explanation of these questions. Wishing you all the best.